The Motherhood Expo, what we're targeting is just getting education out to the community. So letting them know that there are people there to support them throughout their journey, whether that's that they're struggling with infertility, whether they're currently pregnant and want information around labor and delivery, or whether they're postpartum and they need information about like how to get back to normal.
And so is there anything specific that may have also sparked it? Have y'all seen like a rise in, help that these women may need or anything?
Right. So I recently opened my clinic in April, specifically to focus more on the pregnancy and postpartum populations, because I've just found that in this area, there's just a lack of general knowledge around like what options they have and what services are available. So I've had current patients, or I myself, have looked at, what's available as far as like mental health, what's available as far as like a doula in this area if they do want to have, that present at their birth. And, if I'm a provider in this arena and I don't know, I'm sure that a whole lot of people in the community don't know. And the services are there, they do exist, but finding them is a little bit challenging. So we're just trying to make that easier.
Right. And so what would you say is the percentage of people that may not even know about some of these resources?
Definitely a majority. So I would say over 75% probably are not aware of all the services that we have locally, and these are local businesses. So they're not having to drive to Dallas, to Tyler, to Houston to get a lot of these services that are available.
And so you did mention it a little bit, but do you mind elaborating more on who the event is specifically for?
Right, so it's for literally anybody that is a mother or is trying to be a mother. So whether that's somebody that struggled with infertility, we're having some topics around that, but also anybody that is currently a mom, they're expecting, or if they've had a kid, and whether that postpartum experience is recent or it's been years, there is still plenty of resources available that can help.
And so what will happen during the event? I know you mentioned some of those topics.
Right. So during the event, we're going to have a time where they can visit different booths, vendor booths, where those people that have all the local services are available to kind of discuss what they offer. And then we're going to have a time for a panel discussion where you're going to hear from 4 different experts in different areas around various topics like we were talking about. And then after that, we'll have a little bit more time. If they missed a vendor, they can go back to that, and then we'll have a little bit of question and answer, as well as a lot of door prizes that we're going to be giving out.
And just to confirm, this is a free event?
It is a free event, so it's completely free to the community. Like I said, our main goal is just providing education.
And how will attendees be able to connect with each other?
Yeah, so we're going to have time for them to be able to mingle around. Like I said, when they're visiting those vendor booths in the beginning, they'll have plenty of time to connect with each other, and sometimes that's even helpful as far as building relationships and finding other people that are going through the same journey.
And then as for support after the event?
Yes, so we're going to have a lot of informational handouts available with ways to contact each of the different vendors as well as the panelists. And then we will plan on following up just after the event with the attendees to see if they need any additional information.
And then as for attendance, is there a certain number of people that will be able to attend, or is it just unlimited to anyone?
It is open to the community, so anybody that wants to attend, we'd love to have them.
Why is this so important to have for the community? Again, as you already explained some things, but... Right. So there's been just in the U.S., an increase of traumatic births, and I feel like more people are starting to become open to talking about that and their birth experience and maybe how it didn't go how they wanted it to, but also infertility and people waiting later to have kids because of careers or other issues. And then just the normalization of a lot of issues postpartum. So, people are more open, I think, to talking about now what either mental health issues they've had postpartum or just physical symptoms. And a lot of times they're brushed off in the medical community or
you know, it's just like, oh, well, that's normal. Of course that happens. You've had kids. And so, you know, a lot of those things, while they're common, they're not normal. So it is something that can be addressed and should be addressed to help them get back to, you know, where they want to be.